Hi everyone. In this lecture, we're going to be covering the comparison between the pectoral and the pelvic girdles and also a couple of clinical cases that are common. Now that you have studied the structures of the pectoral and the pelvic girdles, you can understand some of their significant differences. The pectoral girdles, they do not articulate directly with the vertebral column. Remember, I said that the vertebral column will help stabilize the scapula by having connections of muscles. But each pelvic girdle does so via the sacroiliac joint that we saw, which is the joint between the ilium and the sacrum. Also, the glenoid cavity of the scapula, which belongs to the pectoral girdle, is shallower than the acetabulum, which belongs to the pelvic girdle. This means that the humerus will have a greater range of motion when compared to the head of the femur, which will be inside of this socket over here that's deeper. Overall, we can say that the structure of the pectoral girdles, they will offer more mobility than strength, and that of the pelvic girdles will actually offer more strength than mobility. In addition, we can say that the pectoral girdle is formed by two bones, which are the clavicle and the scapula, and the pelvic girdle is formed by one bone, which is the coxal bone, or the hip bone, or the os coxa. Now, this is something that I want to make sure that you guys understand. If I'm talking about the pelvic girdle, I say that it's going to be formed by one bone. However, if I ask you how many bones are in the coxal bone, or how many bones are present in the hip bone or the os coxa, then that would be 3, because we have the ilium, the ischium, and the pubis. So if I'm talking specifically about the pelvic girdle, it's one bone. But if I'm talking about the bones themselves, then it will be 3. The ilium, the pubis, and the ischium. Because what I'm really trying to do is compare the pelvic girdle to the pectoral girdle. The female pelvis is going to be adapted for childbirth, and therefore it's going to be broader, as we can see from this red line over here. So there's going to be a larger subpubic angle, which is what's represented here with this red line. And also, if you notice, the pelvic brim is going to be rounder in the female when compared to the male, and this will facilitate childbirth, as there will be a bigger opening for the passage of the head of the child. I did mention this earlier with regards to the angle of the femur compared to the medial line, and this angle is actually called the Q angle. So this is a measurement of the amount of this lateral deviation of the femur from this vertical line of the tibia. And therefore, adult females, they're going to have a larger Q angle due to their wider pelvis than adult males. The carpal tunnel syndrome is going to be caused by the pressure of the median nerve, as we can see over here. And the carpal tunnel itself is going to be this passageway by which you're going to have 9 muscle tendons and this median nerve that will enter the hand from the anterior forearm, and they will all be grouped right over here in this central region. And the walls and the floor of the carpal tunnel are going to be formed by this U-shaped grouping of carpal bones, as we can see over here. And the roof is going to be formed by the flexor retinaculum of the hand, which is this tendon right over here. And all these structures present in this very narrow passageway sometimes will cause the nerve to be pinched, and that's what causes a lot of pain, and it's called carpal tunnel because it's a little tunnel within all these carpal bones located in the same area. On the right, we can see an example of club foot, which is going to be a condition that involves both the foot and the lower leg when the foot turns either inward or downward. and it is a congenital condition, which means that it is present at birth. And with regards to the causes, it is going to be the most common congenital disorder of the legs, and it can range from mild and flexible to very severe and rigid. The causes are actually unknown, but they're most often it will occur by itself. And this condition, it may be passed down through families in some cases, but the risk factors will include the family history of the disorder and also being male. Now, the clubfoot can also occur as part of an underlying genetic syndrome, which is the syndrome of trisomy 18. Most cases are going to be corrected without surgery, and affected individuals will grow up to lead normal, active lives.